I want to be honest about what I thought of her before that afternoon, because it matters. Her name was Lena Marsh. She was young, late 20s, maybe, and she'd come up from the staffing pool on a Tuesday, and the tag on her lanyard said float. Pediatric wing in the same blue block letters they put on everyone they send us when the census climbs, and they don't want to pay overtime for the people who actually know the floor. I'd been an orderly on this ward for 3 years. I knew every nurse by name, by habit, by the sound of their footsteps in the hall. I knew which one took her coffee before charting, and which one charted before she touched the coffee, and which one paused outside the door of a room with a bad prognosis and took one breath before she went in. Lena Marsh, I knew by none of those things. She was quiet. She did her vitals without commentary. She stayed out of the way of Dr. Whitmore, which was what you did with Dr. Whitmore on his difficult days, and by 2 in the afternoon, it was clearly a difficult day. He dismissed her twice before lunch. Once when she flagged a child in room 3 who she thought was running a higher fever than the chart reflected, and once when she asked a careful question about the medication timing on a post-op in room 9. He didn't raise his voice. He didn't have to. He had the kind of dismissal that didn't need volume. A flat look and a half-turn of the shoulder that said he had already moved on before she'd finished speaking. She didn't push back either time. She wrote something in her notepad, nodded once, and went back to her card. I noticed because I noticed everything on this floor, and because I thought, the way you think things you're not proud of later, that she was probably one of those pool nurses who kept her head down to collect the hours and move on. Someone passing through. I was wrong about that. I was wrong about most of it. Room 6 was a 6-year-old boy whose name I am not going to put here, because that is not mine to share. His parents had brought him in that morning for a post-viral respiratory follow-up. The kind of visit that usually ends with a prescription and a sticker and away from the front desk. By 2:40, he was in distress. By 2:50, when the monitor in the corridor began alarming, he was in serious trouble. I got there before most of the team did. The doorway was empty for about 4 seconds, and in those 4 seconds I saw the boy on the table, his lips going the wrong color, the pulse ox reading dropping on the monitor above his head, and his mother at the far wall with both hands pressed over her mouth and making no sound at all. That silence was louder than anything I have heard in 3 years on this floor. Dr. Whitmore came through the door 30 seconds behind me, and then the pediatric resident, and then the respiratory therapist, and then 2 more of our nurses, and the room went from empty to crowded the way it does when things go wrong fast. Everyone who belonged there was there. The team was good. I want to say that clearly, because they were, and because what happened next isn't about blaming them. They worked him. Heimlich maneuver, modified for a child, 3 attempts, nothing shifted. Laryngoscopy next. The resident got the scope in and couldn't visualize past the obstruction. Pulled back, shook his head at Whitmore. The pediatric McGill forceps setup came out and went in and came back with nothing useful. The pulse ox read 61, then 59. The boy's chest was moving. Something was getting through, but not enough, and the thing blocking the airway was sitting in a position that wasn't giving them an angle. Whitmore straightened up. He looked at his resident. I have seen that look before, and I hope I don't see it often. The look of a physician running the calculation and not finding an answer fast enough. The look of a man who is trained for exactly this and is watching the clock beat him anyway. That was when I noticed Lena Marsh. She had not pushed through the cluster of people. She had not raised her hand or announced herself or done anything to draw attention. She was standing at the supply cart near the window, and she was moving through it with a certainty that was completely different from how she'd moved all day. Not quiet in the way of someone staying out of the way, but quiet in the way of someone who already knows what they need and is counting the seconds. A 14-gauge angiocatheter. A 10 centimetri cubi syringe. A length of connector tubing from the bag mask rig on the second shelf. Surgical tape. She had them laid in a row on the cart in about 8 seconds, and then she picked up the angiocatheter and turned and looked at Dr. Whitmore. She said, "I need the front of his neck." He turned around. He looked at her the way you look at someone who just said something in a language you don't speak. I could see him locating her, the pool nurse, the float, the one who'd been quiet all day, and trying to reconcile her with the request. She said it again, and this time her voice had dropped by half, which made it somehow harder to dismiss. I need the front of his neck, doctor. Right now. Something happened in the room then. I don't know if it was the certainty in her voice or the fact that nobody else had spoken or the fact that the monitor had just read 57, but the space opened. Whitmore stepped back. The resident moved, and she stepped forward, left hand to the anterior neck, two fingers finding the cricothyroid membrane by feel. Not by sight, by feel, the way you do it when you have located that anatomy enough times in enough difficult conditions that your hand knows the answer before your brain finishes asking the question. The needle went in at exactly the correct angle. She pulled back on the plunger of the syringe, and the column showed air, clean, clear confirmation, and she attached the tubing with one practice motion and taped it without looking at the tape because she was looking at the boy, and then she looked up at the respiratory therapist. "Bag him," she said. "Low volume. Let vent. Don't push." The therapist had been standing absolutely still for the last 30 seconds. He reached past her and connected the bag and began. The monitor climbed. 61, 67, 74. The room was silent except for the monitor tone and the soft compression of the bag. 82, 89. Nobody moved. Nobody in that room moved. The resident had one hand resting on the edge of the bed, and he wasn't shifting it. Whitmore was standing with his arms at his sides. I was in the doorway, and I had stopped breathing myself at some point and hadn't registered it until just then. 94. The boy's color came back the way it does in children when it comes. Fast, visible, this wave of pink replacing the wrong shade, starting at the lips and spreading, and the boy's eyes opened and found the ceiling, and the mother at the wall made a single sound that I will not try to describe, and I will also never forget. Lena Marsh was already cleaning up. She set the syringe on the tray, checked the seal on the tape, and stepped back to give the team room to work around her. She didn't look at Whitmore. She didn't look at anyone in particular. She picked up a square of gauze, folded it precisely, and held it ready in case she was needed. Then she stood and waited. I heard the corridor door open behind me. I was in the frame of room SIXS doorway, and I stepped to the side automatically. You move when someone needs to get through. And when I turned, I saw a man I didn't recognize. He was older, mid-60s, in a sport coat and pressed slacks with a hospital visitor's badge clipped to the lapel. He was tall and lean, and he had the kind of posture you only carry into your 60s if it was trained into you over years. He was looking through the small window in the door, and then he pushed the door open and walked into room 6. He stopped 3 feet inside. He looked at the setup on the boy's neck. He looked at the tray. He looked at Lena Marsh, standing at the window with the folded gauze in her hands. He said, "Constant." She went still. Not startled, still. The way someone goes still when they hear a sound they haven't heard in a long time and are deciding how to answer it. It wasn't a question. He said it the way you say a person's rank. Flat. Certain. The way you name a thing when you already know what you're looking at. She turned and looked at him. Something moved across her face, recognition, and then a careful composure that settled back over it like water over a stone. And she said, "Colonel Abernethy." The room had not had a chance to start moving again. The monitor read 97. The boy was stable. For a moment, the only people who seemed to understand what was happening in that room were those two. Dr. Whitmore said, "Excuse me, who?" The colonel looked at him. "Elliot Abernethy, retired. I'm consulting on your surgical flow protocols, 3rd floor." He nodded toward the boy on the table. "I was in the corridor when the alarm went." He paused. When he spoke again, it was to the room. "What this nurse just performed is a percutaneous needle cricothyrotomy. The technique she used, the angle of entry, the aspiration confirmation, the way she managed the tube-to-bag connection to prevent barotrauma. That is not something you develop on a pediatric floor." He stopped. "I saw it done exactly that way once before. In flight, at 11,000 feet. Over terrain I won't name. One of my soldiers had taken a fragmentation wound to the throat. We had approximately 90 seconds before he arrested." Silence in the room. The nurse who saved him was a critical care flight nurse attached to our aeromedical element. 2 deployments. She had done the procedure before, in conditions that were considerably worse than this. Low light. Turbulence. No second set of hands. He looked at Lena Marsh. Her call sign was constant. He let that stand for a moment. Then he said, and his voice had dropped a register. I didn't know she'd come back to floor nursing. Lena said nothing. She had not moved from the window. After a moment, she looked at the monitor and then at the boy, and she set the gauze flat on the tray and smoothed it with 2 fingers. "He's stable," she said. "You'll want ENT for the extraction. The obstruction is still in place." That was all. I looked at Whitmore. He was standing in the same spot he'd occupied since she stepped back from the table, and he was looking at her, and I could see him searching for a word, a thank you, anything, and finding that there wasn't one that covered what he was trying to say. Not in that room. Not in front of those people. Not after what we had just watched. He didn't find it. The colonel stayed until ENT arrived. He stood at the wall and kept quiet, which was the right thing to do, because the boy's mother had come back to the bedside and she was holding her son's hand, and the room didn't need anything more than that. When the ENT team came through and took over, Lena moved to the door to give them room, and Colonel Abernethy fell in a step beside her in the corridor, and they talked for a few minutes in voices too low to carry. I finished my shift at 7. I was moving the linen cart past the nurse's station when I saw something resting on the counter near the charting terminal. A small laminated card, wallet-sized, worn smooth at the edges with a faded medical diagram on one side. A field Airway algorithm, the kind of thing you print and laminate and carry in a pocket, so long you stop thinking of it as something you're carrying. She'd left it behind. I don't know whether by accident. I held it for a moment. Then I set it back on the counter, flat, in case she came back for it. I have been an orderly on this ward for 3 years. I have made judgments about people based on their badge color and their lanyard text, and whether they came up from the pool or had a permanent assignment on this floor. I have been wrong before. I have never been wrong the way I was wrong about Lena Marsh. I pushed the card down the hall, and I thought about a soldier breathing at 11,000 feet, and a young woman's steady hands in the dark, and all the things a person carries quietly, in a scrub pocket, in the muscle memory of the hands, that nobody on a pediatric floor ever thinks to ask about.